Are you carrying a ticking time bomb within your chest, silently threatening your very existence? What if the subtle whispers of your body are, in fact, urgent screams for help, signals of a potentially life-threatening condition you might be completely unaware of? Today, we're embarking on a crucial journey to demystify one of the most prevalent and often misunderstood health challenges, heart failure. This isn't just another medical lecture. It's a deep dive into recognizing the early warnings, understanding their significance, and equipping you with the knowledge to safeguard your most vital organ. By the end of this exploration, you'll possess an invaluable ability: the power to decipher your body's language, potentially averting a crisis and extending your life. This knowledge isn't just for you, it's for your loved ones, for your future, and for the peace of mind that comes with being truly informed. Imagine your heart as a magnificent, tireless pump, relentlessly pushing life-giving blood to every corner of your being. Now, picture that pump gradually losing its efficiency, struggling to meet the demands placed upon it. This isn't a sudden, dramatic collapse. Rather, it's a progressive weakening, a subtle erosion of its extraordinary power. This is the essence of heart failure. It doesn't mean your heart has failed, in the sense of stopping. It means it's no longer pumping as effectively as it should. The initial signs can be incredibly deceptive, often dismissed as normal aging, temporary fatigue, or the stresses of modern life. This is where the danger lies, in the insidious nature of its onset. One of the earliest and most common red flags is a persistent, unexplained fatigue. This isn't just being tired after a long day, it's an overwhelming exhaustion that doesn't improve with rest, making even simple tasks feel like monumental efforts. It's the kind of fatigue that makes you question your energy levels, even when you've had ample sleep. The body, in an attempt to compensate for the heart's reduced pumping capacity, diverts blood away from less vital organs like your muscles and limbs, prioritizing the brain and other critical functions. This lack of adequate blood flow to the muscles leads to that profound, unshakable tiredness. It's a crucial signal, often overlooked, but it's the body's early warning that something is amiss with its fundamental energy distribution system. Do you find yourself unable to keep up with activities you once performed with ease? Does a short walk leave you winded? This isn't necessarily a sign of being out of shape, it could be your heart struggling. Closely related to fatigue, and often manifesting concurrently, is shortness of breath, or dyspnea. This symptom can be particularly alarming, as it directly impacts your ability to breathe comfortably. Initially, you might notice it during physical exertion, like climbing stairs or carrying groceries. But as heart failure progresses, this breathlessness can occur with minimal activity, or even while resting. One of the most telling signs is orthopnea, where you experience shortness of breath when lying flat, necessitating the use of multiple pillows to prop yourself up at night. This happens because when you lie down, fluid in your legs and abdomen can shift back into your bloodstream, increasing the volume of blood the heart has to pump. If the heart is weak, it struggles to handle this increased load, leading to fluid accumulation in the lungs. Imagine trying to breathe through a thick, damp sponge. That's what it can feel like. This sensation can be terrifying, disrupting sleep and impacting quality of life significantly. Another variant is paroxysmal nocturnal dyspnea, PND. Sudden awakenings at night feeling breathless and needing to sit up or stand to catch your breath. This is often a sign of more advanced heart failure, and it can be a truly frightening experience, a wake-up call that demands immediate attention. Don't dismiss recurring breathlessness as just anxiety or a fleeting chest cold. It's a critical communication from your heart. Then there's the perplexing puzzle of swelling, particularly in your legs, ankles, and feet, a condition medically known as edema. This occurs because when the heart isn't pumping effectively, blood can back up in the veins, leading to fluid leakage into surrounding tissues. Gravity plays a significant role here, drawing the fluid downwards, which is why the lower extremities are most commonly affected. You might notice your shoes feeling tighter, or socks leaving deep indentations on your skin. Pressing on the swollen area might leave a temporary indentation, a phenomenon known as pitting edema. This fluid retention isn't limited to the lower body, it can also manifest as abdominal swelling, causing a feeling of fullness or discomfort, and even weight gain that seems to defy dietary changes. This weight gain, often rapid and unexplained, is not due to fat accumulation but rather to the body holding onto excess fluid. It's a silent buildup, a slow accumulation of liquid that puts extra strain on your already struggling heart. Think of it as a dam slowly overflowing, and the water finding its way into unexpected places. This fluid retention can also contribute to the breathlessness, as it can accumulate around the lungs. This swelling isn't just a cosmetic issue, it's a clear indication that your circulatory system is under immense stress. A seemingly innocuous symptom that can actually be a significant indicator is a persistent cough or wheezing. This isn't your typical cold or allergy cough. It's often a dry cough, or one that produces white or pink, foamy mucus. This particular type of cough is a direct consequence of fluid building up in the lungs, a condition known as pulmonary edema. As the heart struggles to pump blood forward, blood backs up into the blood vessels of the lungs, causing fluid to leak into the air sacs. This fluid irritates the airways, triggering the cough reflex. The wheezing sound, similar to that heard in asthma, is also a result of fluid accumulation in the small airways, making breathing difficult and producing that characteristic whistling sound. This can be easily misdiagnosed as asthma, bronchitis, or even pneumonia, further delaying proper diagnosis and treatment of heart failure. If you have a persistent cough that doesn't respond to usual treatments, especially if accompanied by breathlessness or swelling, it's vital to consider your heart as the potential culprit. Consider also the subtle but significant changes in your digestive system. Nausea, loss of appetite, and a feeling of fullness can all be indirect consequences of heart failure. When the heart isn't pumping efficiently, blood flow to the digestive organs can be reduced. This can lead to a slowing of digestion, causing feelings of nausea and a general disinterest in food. Furthermore, fluid retention in the abdomen can press on the stomach and intestines, leading to a sensation of early satiety even after consuming small amounts of food. This can result in unintentional weight loss, which, paradoxically, can occur after an initial period of fluid-related weight gain. This interplay of symptoms highlights the systemic nature of heart failure, affecting not just the cardiovascular system but also impacting seemingly unrelated bodily functions. It's a testament to the interconnectedness of our internal systems, where a problem in one area can ripple outwards, creating a cascade of unexpected symptoms. The brain, being incredibly sensitive to oxygen deprivation, also provides crucial clues. Confusion, memory impairment, and difficulty concentrating can all be signs of reduced blood flow to the brain, a common consequence of a weakened heart. When the heart can't pump enough oxygen-rich blood to the brain, cognitive function can suffer. This can manifest as difficulty recalling recent events, struggling to follow conversations, or feeling generally foggy. While these symptoms can be attributed to various causes, including normal aging, if they emerge alongside other heart failure signs, they warrant immediate medical investigation. It's a stark reminder that the heart's health is intrinsically linked to the sharpness of your mind. Don't dismiss these cognitive changes as mere forgetfulness. They could be a silent plea from your brain for more oxygen. Finally, a less common but equally important sign is sudden weight gain, as mentioned earlier. While gradual weight gain is often linked to diet and lifestyle, a rapid increase in weight, several pounds in a day or two, without a change in eating habits, is a strong indicator of fluid retention. This is not fat, it's excess water accumulating in your body due to the heart's inability to efficiently pump blood and remove waste products. This sudden weight jump, particularly when accompanied by swelling in the legs or breathlessness, should never be ignored. It's a direct, measurable sign of the body holding onto fluid it shouldn't, putting an even greater burden on an already strained heart. The twist here is that these signs, individually, can often be brushed off. Fatigue? Everyone gets tired. Shortness of breath? Maybe I'm out of shape. Swelling? Just standing too much. The true danger, and the critical insight you need to grasp, lies not in one isolated symptom, but in the cluster and persistence of these signs. It's the combination of unexplained fatigue with persistent breathlessness, or the sudden weight gain coupled with swelling and a cough, that paints a much clearer, more urgent picture. Heart failure doesn't announce itself with a trumpet blast. It often arrives with a whisper, then a murmur, then a relentless drumming of multiple, seemingly unrelated issues. The payoff for understanding this nuance is profound. It empowers you to connect the dots, to recognize the pattern, and to seek timely medical attention before the whispers turn into roars. Your body is constantly communicating with you. The question is, are you truly listening? If any of these signs resonate with you, if you find yourself nodding in recognition to multiple symptoms, do not hesitate. Consult your doctor immediately. Early diagnosis and intervention are absolutely critical in managing heart failure and significantly improving your quality of life and prognosis. Remember, your heart is your life's drumbeat. Learn to listen to its rhythm, recognize its distress signals, and give it the care it truly deserves. Your future depends on it.